Hello there. Welcome back to episode 2 in our super exciting series. We have Dr. Deanna Pallin here. She is an obesity medicine physician and she practices in her company, New Start Medical. We have the puppy here, okay? Just so you know, FYI, okay? We have, we do, and she's here, and we're going to just roll with it. But we're really excited because episode 2 of our 3-part series today, we're talking about, okay, so now you have a medication, okay? What's going to happen next? Like, what do we expect next? So can you kind of walk us through a typical scenario if somebody comes in, they get started on the med, and now they're on the med, they're in it. What happens? What are they doing? What are you doing?
Yeah. So first I want to give you some definitions, right? What is rapid weight loss?
Okay.
Rapid weight loss is between 1 and 2 pounds per week or 4 to 8 pounds per month.
Okay. Yep.
That is rapid.
That is beyond rapid.
Okay.
I've never seen it.
Yes. So that is the medical definition of it. Mm-hmm. Okay, now why in my practice I don't encourage that is because with rapid weight loss comes muscle mass loss.
Absolutely.
Comes exhaustion, comes dehydration or dizziness or headaches, or you just feel yucky, right? So how can you sustain that? And
Right.
it's not that great for your metabolism.
No.
Now, that doesn't mean that we don't see people lose 10 pounds in a month and feel okay,
Right.
but they're eating their protein.
Yes.
They're not restricting more than 300 calories below their basal metabolic rate.
Yes.
They're not starving their bodies. They're eating the meal plan we prescribe for them, and then they have this powerful medication, and then they can lose a pound and a half, which is a lot.
Yes.
Right? But if I see something like 10 pounds in a week, I'm worried.
Yeah. Oh, absolutely.
I'm worried. It's a lot,
Yeah.
and it's not healthy.
Absolutely. No, I think that is a really good point to start with. And one of the things I love that we talk about is the different phases of weight loss. So there's the initial rapid, and then there's going to be more of the standard, the standard and slow and steady weight loss. And then there's going to be the maintenance phase. And then I love talking about that 4th phase because there's also the regain phase that nobody wants to talk about. And we're going to talk about it.
Yeah.
Okay? So when you tell your patients, you tell me, when you tell them what the realistic expectations are they surprised? Do you find that more people are surprised and they think that the weight loss should be faster? Yeah, me too.
Definitely.
Yep.
Definitely. And, and then I explain why it's not healthy to have such a fast weight loss. And I even tell them, look, you might lose faster than I expected to. That happens quite a bit. But I want to set the expectation to a healthy weight loss.
Yeah.
And then I also teach them to set different expectations for themselves depending on their circumstances.
Yes.
So don't try to lose weight during the month of November and December. Don't try to lose weight, when you're starting a new job, right? And so forth, right? So because when you are going through stress, your body will hold on to the weight. If you are celebrating, you got to choose memories over macros. You have to live, you have to enjoy. So then you have to set your goal to match your circumstance.
Yeah.
And to match what you're willing to put in for it.
Absolutely.
If your goal is always weight loss, guess what? You're going to be disappointed a lot.
Absolutely. Right. And when we talk to patients and clients, we say, listen, this isn't a 6-month journey. This isn't a year-long journey. This is the rest of your life. Because the reality is that you don't just lose the weight and then you just go back to what you were doing.
No.
Right? And it's so funny. Do you get this question all the time? This is a very common question I get. So the question is, so how do I change my macros after I've lost the weight? And the answer is you don't. You actually need to pretty much continue. You can eat a little bit more, but in general, the macros that you need to maintain that loss are pretty similar to what you needed to lose.
You have a little wiggle room with the medications. Though.
Okay.
So what I would say, I find the medications the most helpful in maintenance because it allows you to modify the macros a little bit more.
Yeah.
So it doesn't always have to be like active weight loss if you have a medication there.
Yeah.
So you have some wiggle room. But at the same time, if you go back to what you were doing before and to the behaviors you were having before, it's all going to come back and more.
Yeah, no,
That's just the nature of this condition. It's like that. Just like if you stop your blood pressure pill, your blood pressure will go high. But nobody gets surprised by that. It's like, of course, let's keep my pill. Well, it's no different with the weight loss,
Absolutely.
right? But we're so shocked. It's like, wow, we stopped this medication, so now we're getting all this weight gain. Of course.
Right. Yeah.
It was helping you lose the weight, so you can't just stop it and not put something in its place, right?
Absolutely. I'm going to run this sweet little pup out. While we are doing that, can you talk a little bit about, I think that this is really interesting, but it's this idea of,
She's just excited.
she's excited.
Yeah.
It's this idea of when people come in, right? It's like what to expect next. Do they ask you, can they ever stop the medication?
Yes,
Discuss.
I get that. I get that question a lot, actually. So I say we would try this medication for 6 months of active weight loss if it is beneficial, and if it doesn't cause problems, we will continue for another 6 months of maintenance, right? So be ready to be on the medication for about a year. After a year or 6 months of weight maintenance, then we can gradually decrease the medication and try to stop it and see how your body reacts to that. And it is really based on how many tools, how many of the pillars of obesity medicine you have implemented. If you have the nutrition in place and the medication in place, and you haven't yet optimized the behavior and the exercise, then we need to put those in place before we can take the medication back. So you need all 4 pillars, because it's kind of building your house to resist, bad weather. You are going to be more resilient the more tools you have in your toolbox. So with that being said, there are also patients that do very, very well without medication for the longest time. It comes to mind one of my patients that lost 120 pounds, a woman that did this with nutrition and exercise and behavior modification, and it was until maintenance and regain and having challenges to stabilize the weight in maintenance that we actually implemented the medication. So I see the benefits of medication the most in weight maintenance. All right.
I love it, my friends. All right, so here's what's great about working at home. It's great. You get to be home. Here's what's not great about working at home. You get to be home, okay? And life gets in the way. But thank you for carrying on the show. And so I already know, we talk about this a lot. And it's a really interesting thing. And you might have mentioned this, but the thing that is surprising to me when I work with clients is that it's not that they're worried about like maintaining the weight loss off the med when they're doing the lifestyle stuff. Like they're like, no, listen, I'm eating well. I'm doing the strength training. Will my appetite go up? Probably. But the food chatter is that is usually what people tell me, that their life is completely different because their food chatter is non-existent.
Yeah. Yeah.
And they don't want to come off the med, not because they're afraid they can't do the strength training and they're afraid they can't do the protein.
Yeah.
But it's their quality of life is so much better because of.
Well, it's exhausting to have that constant thinking of what am I going to eat next, and what if I mess up, and what if.
Yeah.
So, a lot of these meds do address that.
Yeah.
And you're right, a lot of people don't want to come off the medications.
Yeah.
Even the ones that were like, okay, I'm going to be on this for 1 year, as you said, but then as soon as it's 1 year, I'm going to come off. And they're like, oh, no, we're not doing this.
Fair. Yeah.
It's just, that's why there's not one script for everybody.
Yeah, right.
You got to try it. If it works, great.
Yeah.
We stay on it. If it doesn't, we try something else.
Yeah.
And you always have to have a tool in your box.
No, I love that. Okay, so one of the things I love about your practice is that, and I give you so much credit for this. I talk about your practice all the time because I know that it's one of the very few. So you practice four-pillar obesity medicine, but your exercise program is in-house. Yes. That is rare, my friends, right? To have an obesity medicine practice where the nutrition counseling is happening, and here's the deal. By you're doing you and your team, your providers are doing the counseling. So
we don't have nutritionists, we don't have dietitians. We obesity medicine specialists, we do the counseling and the nutrition counseling. Yeah.
I love that, and I have to tell you, I did this on a recent podcast. I was talking about my nutrition training program, and when I put the advertisement out there, I had a lot of dietitians that were offended because they told me, well, I should just consult a dietitian. And that's great, except for the doctor needs to understand nutrition too.
Yes.
If nutrition is medicine, and we are the experts of medicine, we have to understand nutrition.
Yes. And there's another thing with that.
Yes, tell me.
I hired a dietitian 7 years ago. So, and I did obesity medicine and counsel my patients for 3 years without the help of a dietitian. Mm-hmm. So at that point, I had 3 providers, and I hired a dietitian to, have an expert on this. Yeah. Well, what happened is that the 3 providers were on the same page on a meal plan that was already successful.
Yep.
And who was confusing the patients?
Oh, gosh.
The dietitian. Because what is taught in dietary school is not obesity medicine.
Okay, I'm glad you said that. I've been waiting to actually talk about this because when I talk about my nutrition training, I talk about this is the nutrition training for optimal weight loss and optimal metabolic health.
It's very different than general healthy nutrition.
Right, like, are you getting enough folate? Okay, like, yes, we care, and like, no, I'm not an expert at that. I mean, right?
Yes.
So, okay, this is great because I want to keep going here for a minute. So, 100%. And when I was getting feedback, like, well, get a dietitian, I was like, I love my dietitians. I love them. And doctors, like, need to know this. And quite honestly, particularly, we don't need to know health policy. Well, we do, but we don't. But we're helping individual patients. So I actually looked into becoming a registered dietitian so that people would just leave me alone.
Yeah.
Do you want to know what my curriculum was going to be? Yeah. Nothing to do with what I'm already providing and helping with. Exactly. It was health policy, like school lunch program. Like it was these things listen, the long game, will those types of things help with obesity in America? Yes. But half the time, like we just want to get kids fed, right? And I'm looking at the patient or the client who's like, no, I have metabolic disease. Yeah. And I'm going to have like heart disease. And I already have hypertension, and I'm already pre-diabetic, and I can't lose weight. Yeah. That's what that's what I teach how to handle. Yeah. So I'm not a registered dietitian, but I'm an obesity medicine specialist.
So that's gold, by the way.
Yeah.
Because a lot of the patients that come to see me is after they saw a dietitian, and after they've done 10 hours of diabetic teaching with a dietitian, and nothing really changed in their health. So we teach our patients in 30 minutes. Yep. And we give them an app and a video and a binder.
Yes.
And they do the work on their own, but with our guidance.
Love it.
And I teach my providers nutrition myself.
Yeah.
And I can tell you how many things I learned from this woman here because her nutrition is amazing. Not to mention that the reason my program is comprehensive is because of the muscle and mindset program, which I chose to incorporate in my practice, and that's designed by Dr. Pallin Novitsky, who is not just an obesity medicine specialist, but like a brilliant mind in how to create nutrition and delicious recipes with macros that will help you enjoy those recipes. And then she distracts you with mindset work while you're doing resistance training.
Yeah.
I mean, how amazing is that? So in my program, every new patient gets enrolled into the muscle and mindset. It's not an option. You can opt out of it. You're getting 2 pillars automatically. Why wouldn't you take it? And everybody that has actually done the work, they come back and they tell me, I just absolutely do it. And I have patients that are doing it from the chair.
The chair. Yep.
And
Absolutely.
I have patients with a walker that were like, I don't even know where to start. They love you the most, by the way.
Oh.
They are like your greatest fans. You are making such a big difference. But you can give the choice. Are you going to do this plus? Because it's not on the insurance. It's going to have a fee.
Yeah.
Right?
Yeah. Yeah.
But in my practice, is included in that
amazing.
startup fee.
It's amazing.
So you take it or leave it. The fee is the same.
Yeah. Yeah.
So might as well take it.
Yeah. Might as well take it.
And then you're gonna love it. That's how you get it done, right? That's my opinion on that.
I mean, I adore it. And here's the really interesting thing after I've kind of pulled the data on all my users of my app training. So muscles and mindset, it comes with 3 different levels. So it comes with the beginner from a chair. It comes with the intermediate. It's somebody who can get from the ground to standing by themselves. Mm-hmm. And then advanced would be somebody who, has done some kind of training before. They can get from the, floor to upward, no problem. They have decent balance, the whole bit. But the other thing that my program does is it actually empowers the providers to offer the exercise. And they can say, listen, you're a level 1, you're a level 2, you're a level 3. And so, the whole, reputation we get as physicians, like, well, they don't talk about nutrition, they don't talk about exercise. Well, yes, we do, right? When that is what the focus is. In obesity medicine, that is the focus. I mean, that is part of it. But I want to say thank you to you, because in the app, the most people that are doing that particular program are New Start Medical.
Yes.
For sure.
Yeah, yeah.
And here's the thing. If we are trying to get our patients to work out, I'm going to tell you this right now. They trust you as the doctor.
Yeah.
They might know me, fine. Maybe they listen to a podcast, great. They don't trust me like they trust you. Okay? So if you actually want to get your patients to do strength training and consistently, okay? Because guess what? Then now your practice is getting better outcomes. Your patients are doing better, okay? That is like brilliant and gold, but here's the deal. They want to hear it from you. So if you give them a link to go sign up, they're not signing up. They're not signing up. Do you want to know how many people have links of mine? They don't sign up. Do you know who signs up? When you say to them, 10 minutes, 3 days a week, non-negotiable. It's included in your first year.
Yeah.
Okay?
Yeah, and I have a poster on this on every single room. And I said, this needs to be done at some point.
Yeah.
And this is 2 pillars.
Yeah.
You're building your house on 2 pillars.
Mm-hmm.
You need the other 2.
Mm-hmm.
And it doesn't get easier than this.
Mm-mm.
I mean, you just press play, and Dr. Novitsky is going to tell you what to do, and she's going to talk you onto mindset work that's going to distract you that you don't even realize how those 10 minutes move. So, I mean, it doesn't get easier than that. It really does. It's a no-brainer.
I agree with you. And let me ask you, so with the Institute, because now you're going to be going on a year into this when we hit June. Yeah. In terms of what you're seeing for muscle mass maintenance, is it making a difference?
Yes, definitely. Definitely. And it's making a difference on the patients that, again, they're doing the sitting exercises.
Yes.
Because the patients that can't walk without assistance, they don't even know where to start. So the biggest difference is there.
Yep, absolutely.
And you know what? I have to counsel them less on behavior. Because they're already, they're like, I don't even use my chair, but I'm going to do the whole phase 1 because I want to listen to Dr. Ali. Yeah, this is what they're telling me. Okay? So it saves me so much time. They're getting better results.
I love that.
And they love it. Every time they come back, it's like, I love it. And you can see how they're going back. By the way, all my team, I have 10 people working for me. They're all on the app, and they're all, they just, it's like...
It's the best. I feel like, because you're leading by example. And again, I'll say it again. So your patients trust you. They want to hear it from you. Yes, they'll follow me when you tell them to, but they want to hear it from you. They want you to give them the green light.
Right.
And so I just think it's brilliant.
Well, I do tell them that the only person that got me to consistently do strength training is Dr. Novitsky. I mean, this is no lie. This is the real thing. I absolutely hated weightlifting. I didn't know how to do it. I was doing maybe cardio at best. And I was an obesity medicine specialist.
Yeah.
And it wasn't until I followed one of your programs, Transform, that I actually became, passionate about it. Not just like, oh, I got to do it so Ali can see that I'm logging in. No, it's like, I'm actually looking forward to the things she's going to tell me about. It's like, okay, this is the way to do it. Because for somebody that doesn't particularly enjoy exercise, which I am in that category, you got to distract my mind from that. Because otherwise, like, oh my gosh, I have to do 3 more of this and then 3 more of this. No, it's like we're going to talk about mindset.
Yeah.
And then the 10 minutes are gone.
Yeah.
And it's 10 minutes 3 times a week.
Yeah. I love it.
That's doable.
So good. Okay, so they're coming in, they're getting counseled on just a realistic expectation for their weight loss. And again, I think that rounding out the end of this episode, can we just talk about kind of, they're going on their journey. They are doing the parameters, they're doing the strength training, they're eating the protein, they're working on their mindset, their behavioral change, they're on the medication. And then they're not quite at their goal, let's just say, and maybe hit a plateau.
Yeah.
How do you advise that? What do you tell them?
A real plateau.
Yeah, talk about a real plateau.
A real plateau means you stay at the same weight for 3 months with optimal nutrition, behavior modification, exercise, and medication. Mm-hmm. You have all 4 pillars and nothing has moved in 3 months. Okay. Yeah. Okay, that's very rare.
I don't know that I've ever seen a plateau.
I've seen it twice in 10 years. Okay?
I know.
I've seen it.
Okay, fine. Maybe.
And what I counseled, I said, your body needs time.
Yeah.
Your body needs time. It will let go of the weight, but you need to be understanding that your body is struggling, just like you are struggling to get this weight off like this. Your body is struggling to let go.
Yes.
But 9 out of 10, if not more, it's like we're missing a pillar. Mm-hmm. Or the nutrition is not quite where you think it is. Mm-hmm. That's why you need the nutrition audit. Mm-hmm.
Yes.
Or you're not eating enough. You're eating too little, right?
Yeah.
And then you get even more frustrated. Like, I'm barely eating. Well, that's the problem.
Yes.
So that's what I tell them.
I have some clients that are I've had, this doesn't happen too often for me, but I'll have some that will be under eating and then they'll go on vacation and they'll come back and they lost weight.
Yes, I get that.
Now this is like on the medication. Like these are my clients who are on the medication, but
that's phenomenal.
But then because they finally are actually eating and the medication is, it's doing its thing, right? So I think that's always awesome. But I'd say the biggest blind spots I see are, it's not really a plateau. Like, I agree with you. I don't know how many I've seen, but not many. But, a lot of the emotional eating that they kind of just, maybe forget about, so it's like, okay, well, this happened and that adds up, right? And so that's why I love when you talk about, there's not just one medication, there's other medications that could help with emotional hunger. But I usually see weekend eating tends to be something. And so I can remember you coaching, because a lot of you probably have worked with Dr. Pallin potentially in my programs, but I remember you coaching on one call, and I think it was a GLP-1 call, and somebody was having this issue with the weekend. They're already on the medication, and you made a really nice suggestion to them. You said, well, why don't you change the day that you dose?
Yes.
Right? Like, so if the issue's the weekend because that's when they're getting hungry, then so I thought that was really great feedback.
So with all these weekly GLP-1s, GIP, right, agonists, they say that, their half-life is 7 days or 5 to 7 days. But you can tell that it's wearing off by the next dose. So if you struggle during the week, then you want to dose it on a Sunday, right? So then you have those 5 full effect days during the week. If you struggle on the weekend, if you dose it on Sunday, guess what? By Saturday, you're hungry. So dose it on a Thursday.
Yeah.
Right? Or on a Friday.
Yeah.
So it's like you can play with the dose a little bit.
I love that. And I think it's a really good because, a lot of times I have clients that they're so programmed that they will restrict during the week, and then the weekend is a free-for-all. Mm-hmm. And they still in their minds want to do that even on the medication if they're not hungry, because it's just a pattern.
Yeah.
And so I love that. I thought that was really, really helpful when I heard that. But I typically see weekend stuff, not enough sleep. So if they're not sleeping, the hunger hormone increases. And so the effect of the medication in terms of satiety and helping with hunger is not as strong.
Yeah.
So that's another one I see, like with the obstacle. Stress, yes.
I mean, nobody's stressed.
I mean, nobody's
right?
stressed,
Yeah.
but so, I don't know, not my people anyway.
Not mine either.
Yeah. And so the stress, and again, I know I talk about it a lot, but cortisol increases. When cortisol increases, okay, it's going to increase your blood sugars, but it also inhibits the action of insulin. So insulin isn't able to do its full job and really drive that substrate into those muscle cells, let's just say, or liver cells or wherever. So now you have a higher blood sugar hanging around. Your insulin really isn't working. And then over time, it's going to lead to more of an insulin resistance type pattern. And so stress is real. Like, this is a real thing. This isn't just like, oh, well, stress is bad. It physiologically will cause individuals to hold on to weight.
100%.
100%.
Yeah, definitely.
All right, my friend, I so appreciate you being here. I cannot wait to dive into our final episode in this series, okay, where we are going to be talking about you hit your goal, now what?
Awesome.
I can't wait to hear what you have to say on this one. All right, my friends, we cannot wait to be back next week. Until next time, remember, all of Dr. Pallin's information will be in the show notes. New Start Medical. She has an amazing practice in Doylestown, Pennsylvania. Clearly, she is an expert that practices 4-pillar obesity medicine. She's one of a kind. I love her. She is a dear friend. And again, so great to have you here.
Thank you for having me.
All right, my friends, until next time, we'll see you soon.